CardioMems is a sensor that goes into your pulmonary artery, which is one of the big arteries that comes out of the right side of your heart. And what it does is it basically gives you something called a right heart cath at all times of the day. So what it would tell your cardiologist or your primary care doctor who would be following this is what pressures are inside your heart at all times. Using this information, they can help guide management of your medication, specifically your diuretics, which are the water pills that help keep water from accumulating into your lungs due to heart failure. And so I just wanted to show you what the CardioMems device looks like. It's not a big sensor at all. This is the actual size. So I don't know if it's hard to see, but it's about this big. So usually we go through the big vein in the groin or the big vein in the neck, and we snake a catheter down into your heart through the heart chambers, and then we put it into your pulmonary artery. And then we basically find a good place to place the sensor in your pulmonary artery. And then we release the sensor, we measure the pressures and calibrate it right there in the cath lab, and then you get to go home the same day. So after you have the CardioMems placed, you'll be sent home with a device that is similar to a pillow. And what you'd be asked to do is to just lay on the pillow once every day for a few minutes. Initially, when you start out with the CardioMems, you may be laying on the pillow for up to 2 minutes, but as you kind of get adjusted to knowing what position is best, it usually lasts only a few seconds. Every time you do this, your cardiologist will get a reading about what your PA pressure is, and then they will be monitoring your reading every day. And if they notice that your reading is getting higher, they'll end up giving you a call and adjusting your medications. Same way as if they're noticing your readings are getting low, meaning that you're getting dehydrated, they'll back off on your medications. And this is usually good for all patients who have been in the hospital even one time due to a heart failure exacerbation, where they get really short of breath, they get swollen legs, they have a lot of difficulty breathing due to their heart failure. Or it's for patients who have had heart failure for a long time but are not feeling very well with their heart failure with the current medicine management, and they have a known elevated BNP or pro-BNP. What the CardioMems provides is a way for us to remotely monitor these patients and effectively adjust their medications with actual raw data, rather than having to rely on just the physical exam, just the symptoms, and just your lab values.